Is National Stroke Awareness Month. Somebody in the U.S. has a stroke every 40 seconds, according to the National Institutes of Health. It is one of the leading causes of death and disability in the country. Nearly 800,000 cases are diagnosed each year. Well, doctors say there are several signs that you can look out for. This morning, we have Dr. Bey Leslie Maswi here in the studio to tell us more. So, good morning, doctor. Can you actually start with what a stroke is exactly and why is it so very dangerous?
Oh, good morning. A stroke is a disease of the brain where there's a problem in the blood supply. So either a blood vessel blocks or a blood vessel bursts. And your brain needs a constant supply of blood at all times to work. So the minute there's a blood supply problem, the brain stops working.
And of course, that's critical because you do need that blood flow to the brain. One thing I want to touch on, something called a warning stroke. What is that exactly? And is that as serious as an actual stroke?
So warning stroke is often called a transient ischemic attack, and it's a sign that a clot traveled into the brain or into the eye, stuck there for a moment, and then dissolved away. That's good news because you don't have a lasting symptom from it, but it's a sign that you have a place where these clots are coming from, and you might have a much bigger and more serious stroke to come. And so you need to go in and get checked out if that's something that you experience.
So what are some of these warning signs? Let's say if I'm at home and I'm with somebody and I'm seeing something physically happening to their body, what would some of those signs be?
Yeah, I think the key word to remember is fast. So face drooping, arm weakness, any speech abnormality. So it might be garbled speech, slurred speech, or the absence of speech altogether. If any of those signs are present, then think T for time. So face, arm, speech, time. T, time, call 911.
Right away to get a doctor.
Right away,
yes.
yeah.
What about, I mean, when we think of heart attacks, we think of administering aspirin or something like that. Does that apply for stroke?
No, for stroke, the main thing is to call 911. The reason you wouldn't do something like give aspirin is you don't know if it's a blood vessel that's blocked or if it's a blood vessel that's burst. Aspirin makes bleeding worse. It helps if there's a blockage. Most strokes are actually caused by blockage of blood vessels, and we have excellent treatments.
You see. So who might be at risk for more stroke? Could it be age? Could it be body weight? What are some things that people should be mindful of?
Yeah, good, both of those actually, but because it's a blood vessel disease, think of anything that's bad for your blood vessels. So if you have atrial fibrillation in the heart, if you have high blood pressure, that's actually one of the most important of them all. If you're diabetic, if you have high cholesterol, if you don't exercise much, inactivity is a risk factor. If you have sleep apnea, all of those things are bad for blood vessels, which means they're bad for patients that have stroke or at risk for it.
Noted. And what about anything that we can do to prevent a stroke? Can we start changing our diet? Should we get screened for it, perhaps? Does that even exist?
Yeah, so the main thing is to think about those risk factors and address each of them as aggressively as possible. The thing about stroke that I think is so painful is that it's a completely preventable, treatable, recoverable disease. And we aren't doing a great job of preventing strokes, and we could do a better job of getting treatment to people if they called 911 and got to help faster.
Wonderful. Thank you so much, Dr. Bey, for these insights. I'm sure that a lot of us will be mindful of this now, so thank you very much.
Oh, we appreciate you highlighting the disease.
Of course. May is National Stroke Awareness Day, and of course, month rather, so be sure to check our website for more information.